He takes off, soaring higher than ever. Magnificent flight.
Welcome back to MTP. I'm here with Dr. Alfie.
It's great to be
Dr.
back.
Paul. And today this is going to be a fun one because I'm sure you've been missing Perito urology and urofill when you're reading all these things about Penisgate. Penisgate is supposedly these ski jumpers, right? That were administered some girth enhancement material, supposedly to make them more aerodynamic in their jump. Now, we happen to have a little bit of experience with this stuff. So first, Alfie, I need to ask you, we have some similar experiences with some of our patients that get penile implants when they're going through the airport and they use that non-ionizing radiofrequency imaging to take a look. They're looking for volume. And do you remember the story?
Yeah, no, we had this one patient that, it's the only time that I remember having it, that he went through one of these x-rays at the airport, the ionization and everything, but there's a gain of volume there. It's like a void of volume, and they know that. And this patient, his English wasn't the best, and here in Miami, he said, I have la bombita. So imagine if somebody doesn't speak Spanish, that means little bomb. When in Spanish, it means little pump. And right then and there, TSA tackled him, this whole thing, and he had to explain, and we had to send proof that it was all good. But meaning that volume in that area can be deceiving in all different kinds of formats, especially when we're talking about skiing.
Well, there's no more Seinfeldian shrinkage when you have a penile implant in place. So there's more volume. So we tell our guys, you might get, patted down, and they might think you're, hey, you should be proud of that. That's the way I see it. Now, what I imagine, this is not a conspiracy, what I imagine happened is that somebody who got a lot of hyaluronic acid for their penile enlargement, and there's one of the news reels that I saw, there's actually a plastic surgeon that says that he injected some skier, which that seems very unethical to be talking about your patient that way, but I can imagine they are scanning them to make sure that their suits are within whatever criteria, because it's true. Maybe, laterally, an inch or a centimeter on each side, you can get more lift. But he just so happened to have a prominence just like at the airport.
Exactly.
And so that I can see happening in a nanosecond to a skier who happens to have had penile enlargement using the urofill technique properly, not as the paper, that one article said, the dosage was high. It's not dosage, it's something else. But I don't think it's a conspiracy. I think somebody just was found out to have more junk in the trunk.
But maybe it's a good idea for a study next ski season. I'll give it a try and hit the slopes and tell you if I get any better.
We're on. All right, Penisgate is not a conspiracy, guys.